Myself Professor Dr Srikant Kumar Dhar from Bhubaneshwar, Odisha. Welcome you all to this Apicon. I am talking about paraquat poisoning today. Why I am talking about this? Because this is quite lethal and the mortality is very high, and it has been seen in many parts of India and from my state also, South India and some other parts. People take this and farmers take this and mortality is very high. That is, you should know how to take care of this patient. Now, why this agent, the paraquat, is usually used by the farmer, very little amount of few ml they use in 1 liter for used as a herbicide, and accidentally people take this. Some other forms of like inhalation, like skin contact maybe or IV maybe, but it is very unusual. So, usually the injection like a suicidal agent is found in many hospital, and the patient present with so many complications. The complications like multi-organ dysfunction are very common to this patient. Usually in the first week they present with some sort of GI infestation or renal dysfunction. So, the clinical manifestation are early, it all depends upon how much patient has taken. If patient has taken 20 milligram per kg less than that, then probably mild symptoms will occur. The mild symptoms like GI toxicity, vomiting, pain, abdomen will occur, and probably some oral ulcers will occur. But if patient has taken more than 20 milligram per kg, then mild, moderate to severe symptoms occur. So, in that case, initially patient may present respiratory symptoms like pulmonary edema, ARDS, and patient may have to be intubated, and in late days, probably into the next 2 to 3 weeks, patient may develop chronic lungs disease like fibrosis, and that is the cause of chronic illness, and most of the patients they deteriorate after 1 or 2 weeks of illness. So, in these type of patient, they usually they recover initially, but usually they go to secondary complications also. Other complications, the paraquat also affect multi-organ. Apart from lungs, it affects the kidney, acute tubular injury and renal failure are common in first week or so. This can be treated. Sometimes perfusion, hemodialysis is also indicated in this type of patient. So, how to treat this patient? First and foremost, you have to take the history and confirm that patient has taken paraquat. The amount of fluid what has taken is very important. Initial resuscitation is ABC, you know, has to be done, airway, breathing and circulation. Most likely 20 to 30 ml of normal saline has to be used initially, because hypoperfusion is very common, and later on you have to first decontaminate the patient. Gastric aspiration is contraindicated. You have to put a Riles 2. Riles 2 is put to check the stricture of the GI tract or esophagus, you can say, and you can put some activated charcoal, or sometimes multani mitti is also used to observe this, you know, primary treatment of this type of patient, and later on you can use according to the symptoms. Sometimes if you are having renal failure, you have to go for the hemodialysis, and you have to, there is no definite guideline to treat or no definite treatment antidote available for this patient. So, usually it should be treated as per the treatment or complication, and sometimes you have to give secondary modalities, like some studies say that cyclophosphamide steroid has got some role. 2 to 3 days of cyclophosphamide and steroid can be given sometime in severe cases. But if you say the severity, the prognosis is very bad in this patient. Patient has taken 20 to 30 ml. If patient has taken 50 ml per kg, more than that, probably the prognosis is very bad. So, first and foremost is to awareness of the people and to avoid this type of agent, because in Europe, or you can say in other countries, USA, this has already been banned, but our farmers are using this for herbicide purpose, but for suicidal purpose, because it is used, we have to avoid them, and we have to treat them early to get to avoid all these complications. So, thank you all. Thank you for patient hearing. Namaskar.